Jane Center a few times in the past. I currently live in California. I specialize in orthopedic surgery, but subspecialty in hand, wrist, and elbow surgery, but I have a lot of experience in all parts of orthopedic surgery. I don't have a specific presentation, but I'm happy to answer any questions, anything specific on anything related to orthopedic surgery or joint health or how to keep your joints healthy as we age. I think that's a big topic that more people are talking about now. There's a lot out there on what kind of things can we do that are practical and what's not practical to do to keep our bodies healthy, because at the end of the day, there's a lot of fads out there, a lot of medication and a lot of supplements, and everything changes every year. But there's a really core couple of things to know to make sure you keep your joints healthy long term. I'll kind of go over a couple of things and I can answer any questions. I think if you think about what happens as we age, is that when we're young and healthy, everything's good. But as we grow older, we lose muscle very quickly, which is natural as the aging process. When you lose muscle, your joints really need to be stressed in some way to stay healthy. So when you start losing muscle, you start being less active, you put less load through your joints, they develop arthritis, and you don't walk, and everything goes down from there. So some practical things you can do are a couple of things. First off, the main problem is that it's truthfully that we all know what we should be doing, but it's hard to do it. We all know that we should eat healthy to prevent obesity and make sure that we're putting less stress in our body. But it's the hardest thing to do, especially with our lifestyles and diet. So staying on a well-controlled diet, a well-rounded diet with not just like a healthy vegetarian diet, but well balanced in terms of avoiding fried food, avoiding alcohol, making sure you're eating balance in your food. So with the leafy vegetables, multicolored vegetables, fruits, dairy, and all that. The second part is making sure that you stay active. As we age, we become less likely to do activities that stress our bodies, and that causes a lot of issues. When we're young, we play sports, we run around, but as we get older, even if we're able to do that, we go through cycles where we want to walk and then we walk less, and then you don't do anything that puts pressure on your joints, so that causes your joints to deteriorate very quickly though. So first one's eating well. Second one is making sure you do strenuous activity. And as we age, it doesn't mean you have to lift weights, but a good one, especially for South Asians, is yoga. Yoga puts a lot of stress on your body in a good way. It's very controlled, but it makes you work a little bit for it so that it can actually help maintain joint health long term. And the last thing is that just probably stay away from most supplements. There's no evidence to really suggest that the supplements we take, like glucosamine or chondroitin sulfate, actually do anything for us. Though actually, they can actually cause more harm in high doses, or even taking very high doses of turmeric pills or any other medication. Those things can actually cause some other issues if they're not regulated too much. So kind of basic stuff, but I wanted just to see if anyone had questions on anything specific, and I could probably answer those. So B12's, we don't, B12's okay to take, but most multivitamins, I just suggest to everyone just take a regular multivitamin. Usually has enough. If you have a B12 deficiency, then you can take it. But most diets today are not really too deficient in it, especially Indian diets. You don't see many people with B12 deficiency though. I don't think there's any harm in it. I just don't know if it's going to help.
How about vitamin B?
Yeah, so I think especially in postmenopausal women, so once you hit menopause, you stop producing estrogen, which helps protect your joints, and in men a little later. So anyone who hits menopause, so women after, in their late 40s, early 50s should get a bone density test. They'll tell you exactly what you need to take. Men usually by the time you're in your 60s or after 65 can get it. And what a bone density test does, it tells you exactly how good is your bone quality. And based on certain numbers, if it's between certain numbers, that tells you that you're healthy enough, your bones may be a little weak, and you can still take calcium and vitamin D supplements. you can't take one and not the other. You really need both to make it work because they are metabolized in the same thing together. So if you take calcium, it doesn't do anything. You just take vitamin D, it doesn't do anything. You have to really take them together. And most supplements have them combined. So every postmenopausal woman, for the most part, should be on a calcium vitamin D supplement. And if your scores are very severe, that's when your doctor starts talking to you about these other medications that help promote bone growth. So some of these are, they're called bisphosphonates, like Fosamax is one of them, and there's some injectable ones now. But you only have to take those if you're getting to severe levels, though. The whole point is that it doesn't matter if your bones are strong, but it only really matters to prevent a fracture. Like if you fall and break your hip or break your back, that can really change your life. So this medications really help to prevent fall risk and prevent fracture risk.
So injectable Fosamax does not cause, okay? Because oral Fosamax does cause inflammation.
Yeah, so all these have side effects. So the jaw necrosis they're talking about with Fosamax, even Zometa, all these can cause it. So there's risk with taking them. So most patients who are on it don't take it for, they come off of it for a certain period of time. Like they take it for a year and then come off for a few months to prevent all that from happening though.
Also, that becomes ineffective after years or so.
So it depends, like you usually take it for a few years, then recheck your bone density, because some patients don't need to be on it long term. So if you take, there's really not good guidelines for how long people should take it, but most patients will take it for a few years, come off of it, check it to bone density again. And if it's stable, you can stay off of it and take vitamin D, calcium, or if you're getting side effects, you stop taking also. But there's several other medications now. It's not just Fosamax, the only one. There's injectable ones. There's ones you just take monthly or even annually now also. So it's good for like cramping. So some women during pregnancy will take magnesium if they're cramping. But I think once again, like everything in your normal multivitamin has plenty of that though. I wouldn't, unless there's an issue, there's not really a reason to take magnesium separately though. So calcium comes in supplement form. The dose I think is 1,500 milligrams, remember? And then, but what I was saying is that calcium by itself is not going to get metabolized in your body to your bone. You have to take it with vitamin D. So most of the supplements now contain both. Yeah.
Or vitamin D,
Mhm.
like in the morning, I'll take two supplements.
Yeah, so that's a little separate. So vitamin D deficiency is what a lot of people talk about. And if you look at even in sunny places like here or in Hawaii, a lot of people are vitamin D deficient. No one really understands or knows what the real cutoff is. The cutoff changed from 30 to 20 overnight. Like no one, it just was the policy change without much data. So if you're above 30, then it's considered healthy. You don't have to take anything. If you're between 20 and 30, they say, at least have some supplement in your multivitamin or separate. And if you're below 20, it's considered severe. You should take a real supplement. Though. And that's not just for bones, but there's a lot of things that it helps with separate. But most people should, with their normal lab work, at some point should check their vitamin D level because you'll be surprised how low most people are.
Calcium you said 1,500 milligrams, but bodies that cannot excrete it, that ends up in kidney stones. And that is what is found out in the Midwestern country where Midwestern where people grow up on tomatoes, farm tomatoes, and by the time they grow to a certain age, they all get kidney stones. So yeah, either you drink plenty of water and that is the these lipids are put up in the Not to start.
Yeah, I mean, I think the 1500 is mostly geared towards postmenopausal women. Like everyone shouldn't be taking calcium. There's no need to, but it's people who are deficient in like the bone density of their osteopenic. And the vitamin D technically helps prevent that a little bit, the high excretion, but that's why people shouldn't take like heavy doses all the time. And renal stones are very common, with taking calcium. You'll see a lot of people taking it and getting renal stones that has. Yeah, so glucosamine chondroitin, technically, they say that, okay, well, your cartilage has glucosamine chondroitin in it, so it should help promote cartilage healing. But if you look at every study ever done, it's never shown to be more effective than a placebo. So it's a big marketing thing that started 30 years ago, and it's safe, it's cheap. But glucosamine per month, maybe it's like $6, it's cheap, but it probably doesn't do anything though. So I tell everyone it's not harmful. It's probably not going to hurt you, but it's probably not going to do anything either. It's actually been only shown in very early arthritis to help, like very young arthritis, but most patients don't know they have it until it's more severe though. Actually, the one medication that's been shown to work is actually, ironically, it's turmeric capsules, like hard turmeric. It's been shown to help reduce pain associated with arthritis. So, but it comes in a capsule form. I think it's a gram, just a capsule you take in them.
And people have been trying to take this because we have some but it's actually with curcumin.
Curcumin, yeah. So most of the combo tablets are also.
ભરતભાઈ અને માલતીબેન તમારે પર કોઈ ક્વેશ્ચન હોય તો અનમ્યુટ કરીને પૂછજો ઝૂમ પર.
Okay, thank you.
No, I think it's more like if you don't take calcium properly, it's not going to do anything for you though. Because I mean, calcium's all over. It's based. Your bone's made out of calcium predominantly. So, just if you keep taking calcium, you may just excrete it where it doesn't go to the right place though, without the vitamin D supplement.
But then have you ever advised like that would like if you have your baseline bone density, if you're taking enough milk, maybe 2 glasses of milk every day, then you can reduce your dose of calcium if your bone density is stable.
Yeah, so I think it's just hard to know how much people are really drinking though. So I honestly, the safest thing to do is everyone should just take a multivitamin. You're getting enough in it of everything you need, and it's not going to be harmful. So unless you're osteopenic, there's no reason to take anything extra that you don't need to though.
I have a question about the walking. Like, what do you suggest? Like if somebody walk heavy, as the age come, like the walk should be legs or like what?
So the problem,
yeah,
the problem with walking is that it's not a problem, but I think what happens is there's other options that are probably better. So if someone has access, very common now is like aquatic therapy in the water, right? You're in a pool and you do running in the pool or exercises. Yoga is a very good one. But I think the problem with walking is that even if you walk a long period of time, you're just walking with your legs. You're not doing anything with your arms. You're not doing anything with your chest. You're swaying your arms to walk. And that's fine if we get to the point where we're unable to do other things though. But I think now there's a big movement towards trying other things other than walking if you can. Or even walking with weights helps, or speed walking. Just because you're not putting enough stress on your joints at the time. You're putting on your knees a little bit, but then you walk slowly for a long distance. It helps, cardio and all that, but it doesn't do enough of anything to make it too much of a difference, unless you can't do it though.
My question was like, if you walk more, does it affect knees over the age or not?
Not at all. So I think if you look at what happens, people say if you walk too much, you'll get arthritis, which doesn't make any sense though, right? So what happens is when you walk, you're actually there's something called Wolff's Law, where if you put stress through a joint, it remodels the bone to make it healthier. And then when you walk, you're actually making the fluid in your synovial fluid, like the fluid in your knee, spread more and lubricate your joint. So the things that hurt are if you have a trauma, like you hurt yourself or you fall, or actually the biggest one is when people stop being active, they sit around more than walking. That stuff's much more dangerous to your joints than anything else, though.
I think his point was more that if you're overweight and you put too much burden on your legs, would your knees go bad?
No, I mean, I think I think the caveat is that we talk about, okay, well, we should exercise and all this, but how do you do it if you're obese, right? So yeah, it's a good thing to do. It's any load you're putting through your joints if you're heavy is hurting it over time. But there's probably more harm in not doing that though.
But, yeah, we thank you for having the change center. How about treadmill? Sometimes, but you run on treadmill, that will hurt your knee. What do you recommend?
I mean, I think it's a small distinction. So technically a treadmill, the threads are going towards you and you're striking your foot down. So technically it's like the impact over and over again, they say may not be the best thing. So all this is better than not doing it. Walking outside or running outside is probably better because it's not hitting like that. But that's, these, if you do like thousands of times over and over again, maybe it's not good. But walking outside's better. But especially in cold weather, like if you're in Chicago or Boston, it's better than sitting around, right? So it's a good option. So
Is elliptical better treadmill if you?
yeah, I think elliptical is much better because you're using your arms with it also, and you're not striking the ground. So there's something called closed chain. Closed chain means your feet are planted in place. You prevent injury that way, right? So you can't hurt your knee if your knees are just in the same spot moving.
Oh, you were talking about the vitamin D. Is it like getting one from, because we are blessed here with sunlight?
Mhm.
Is it better to get it from there or rather for the supplements? Which are the better options?
So in Hawaii, there's like more than half the population's vitamin D deficient. It's something to do with the diet there. They don't drink a lot of milk in Hawaii. They don't do a lot of dairy, except for sugary dairy. They eat a lot of red meat. Not that much of a problem in Indian population, but still, like you never know who really is deficient. So yeah, there's no reason to take supplementation unless you're really low. And I'd say really low means under 20. Um, on the numbers they show you, but there's really no need to take it extra though, otherwise. So I mean, yeah, if you get in the sun, it's good, but we don't really know how much sun you need to make that go higher, right? Like it's obviously good to be in the sun as much as you can, but how much is enough to make it worth it?
15 minutes of sunlight is enough for it.
Yeah.
15, no, you don't need more than 15 minutes. And there was one study, I did a special, there was one study done that people working in operating room and nurses in operating room, they did a study, because we never get exposed to sun. We are in operating room all day. And they had more vitamin deficiency than other population. So for 15 minutes of sunlight is enough rather than taking all this junk.
Exactly. You only take the junk if you need to. Yeah.
Eat lot of cheese, milk, and sunlight, you don't need it.
Sorry, say that again. So it's the solutions usually to try your diet, increase your diet some ways. So, today even orange juice is fortified with calcium and vitamin D these days because a lot of kids who are lactose intolerant. So there's so much stuff that's fortified already that's easier to digest than a tablet then. So they suggest adding it to your diet. The problem is you don't want to add it with like a lot of things that are maybe not good, right? Like creams and things like that. But adding it with like, you know, with milk or something else that's easy to access, but not too heavy in other things though.
For osteoporosis, like natural, not the supplements or.
Yeah, I think the problem is that anything natural for you know, if you think about what it gives you vitamin D and calcium, a lot of it's animal protein, right? So milk and all that. Problem with the Indian population though is that drinking too much dairy is, your arteries don't care how much vitamin D you have, right? That's anytime you drink whole milk or eat something heavy, that's depositing in your arteries, making us just more at risk for getting a heart attack or cardiac event though. So it's like two separate things, like bone health and what your heart thinks are two different things. So ideally, it's good to get in your diet as much as you can, but there's a lot of barriers today about doing that safely if someone's really deficient though.
And we think, I believe, that it also be more like this, it's not absorbable easily unless the calcium citrate or calcium.
Yeah.
That would be provided to, so that it all turns into the form of calcium citrate. And that is the problem if you want.
Yeah, so you could, I think if you take it in if you need to take the supplement, just take in the vitamin D supplement form, and it's gonna solve most of those problems then.
So the natural course of taking it is also you won't know how your body assimilates it, whether it absorbs it, whether it secretes it. So supplements are sure.
Yeah, then the supplements, just taking it if you're deficient or, everyone with after menopause probably should be on it anyway, so.
So Amar, in most of the people's diet, in Punjabis, Russian, they usually yogurt or buttermilk as part of the staple diet in the lunch. Then there is a needed way of taking the calcium.
Yeah, it is. It's definitely an easy way if it's already there. Yeah.
One of the staple.
Yeah, I think it's just knowing how much you're getting total, because I think still postmenopausal women should be getting 1,500 milligrams, which for Indians is easy, but some cultures like Chinese, like they don't drink dairy products at all, so they're much more. Even Caucasians, like they develop osteoporosis a lot quicker because their food's really not that heavy with dairy though at all. And red meats and all that don't give you, the same as dairy products.
Any more questions?
Okay, I have one more question. Kind of how is it little different, but what do you suggest? Like most of the Indian people I have seen eventually get gout or something. So what do you suggest?
So gout's a disease when you get crystal deposits in your joints, and it happens mostly in men. It's very rare to have it in women. It's from these crystals called uric acid to having high levels in your system. So gout happens because of, predisposition genetically, but mostly gender based. And it's usually habits with gender. So it's very common with alcohol use and red wine use. So Indian men drink more than Indian women. From eating certain foods, which is not common for Indians, like red meat causes it. But truthfully, when someone has gout, for like a male especially, it's the most important thing. I see a ton of gout with the hands, especially also. The most important thing is to make sure you know why you're getting it. So it can happen because there's uric acid is being produced too much in the body, or uric acid is not being excreted quick enough in the body. So getting a uric acid level from your primary care doctor will tell you what the level is. And then there's a ton of medication that you can start taking to keep it down. Because what happens that if it's not controlled, what we usually do is when you get a gout attack, you take an anti-inflammatory like colchicine or Advil, but then you're not fixing the problem. It keeps happening then. So it's usually knowing why. So that's usually lab studies for that. And then there are some very safe medications to take, depending on why it's happening though.
Is there a connection between B12 and gout?
No, there's some studies that they went through like B6 and B12 and all that, but I don't think if any of it's been really proven to show like why that's happening though, as far as I know.
I think I can throw some light. I always thought that soaking our chlorine in water and throwing that water away was throwing away the protein, but that's not true. They say discard the soaked water, wash it after it has been soaked, that, because that contains maximum uric acid. In olden days, they used to make dal in an earthenware pot, and all the paint that used to be on the top was removed from the dal. That's how we cook, slow cooking. Now we are cooking fast, and that's keeping the uric acid in our body. So that's what is causing the gout problem. Yes, it is. Yes, it is.
I can agree with it with rice. If you soak rice, it takes out but our rice, at least like what we get from Mexico's one is not high in arsenic, so I don't know if that matters.
So draining the rice after it has been cooked removes the arsenic 50%.
It removes a lot of, yeah.
Yeah, it
And I,
removes.
the.
So we thought that draining the rice after cooking removes all the nutrients from it, but it removes the arsenic also. 50% of the arsenic comes out if you drain the rice after cooking. That's how our moms cooked, and we always told them, Mom, you're draining away all the vitamins from the food. But that there is some truth to it.
You use for the cooking.
No, the water has arsenic. You can start your clothes with it. You can start your clothes. Yes. So any more questions for Amar?
If you have a hairline fracture, I'm just scared now to do certain exercise.
Yeah.
Any question for Dr. Amar?
Yeah, so the question that Auntie had was that if you have a hairline fracture, is there a risk it can happen again? Because then you get scared to do it. The hairline fractures happen once you have osteoporosis. Like if you fall, if you're 25 years old, you're not going to get a hairline fracture unless it's like a car accident. But slip and fall here, even from a chair, cause it once your bone density is bad. So, like stretching and all that's not going to cause anything to break or snap. These are really heavy bones, like in the hip. They're very strong. So it's very difficult to break them, even when their bone quality is poor, right? So stretching all that won't, but it's fall. Like if you fall, you still have the same risk. So that's what all these medications, vitamin D, calcium, the only reason we take them are to prevent injury from falls because your bones get weaker. So things that shouldn't hurt, shouldn't cause it to break, and then it's a long rehab type of thing. I don't think like stretching itself, it's not gonna really, biomechanically, it can't cause it to break because you only put so much load through your joint till it feels comfortable, Yeah. I mean, it depends what, if it's like a tendon or a ligament, it's one thing. For most muscle tears, they heal on their own with the rehab. So you can be evaluated by an orthopedic or a sports medicine doctor, but the treatment's usually just rehab though. If it's a tendon, different story, because some of those need to be fixed or a little more involved though. Yeah.
There was a question, sir. Mohit, go ahead and ask the question. Mohit, you can unmute.
Okay, hi. Jai Jinen, this is Mohit. Can you hear me?
Yeah.
So there are like certain things that you hear from other cultures, which is, sometimes Chinese or Japanese, such as like, chia seeds or quinoa or green tea and the health benefits associated with it. So a lot of times our body is not used to it and we haven't been exposed to since childhood and all that. So once you start taking it, you feel that your body is not cooperating, right? So in those instances, should we ignore all of that and then say, you know what, there are more health benefits compared to what you are experiencing and just continue to take that, or just say, no, my body is rejecting it, I should really stop taking it?
So the question was that there's a lot of other things you can try, like green tea or chia seeds that we're not used to taking but have health benefits. So if you take it and don't feel it agrees with your body, is it okay to keep taking it? So the reason why all this stuff has become popular, because there's this whole idea that antioxidant food. So oxidization is a process that causes, that's basically part of your body that can cause harmful chemicals released that can cause mutations, that means cancer or other things. So that the reason we take these antioxidant foods is because it decreases the chance of that happening. So antioxidant foods are like blueberries, dragon fruit, chia seeds, green tea. And, we don't use a lot of those, a lot of, it's very new, it's very common Eastern stuff, like in Japanese and Chinese culture, which is why a lot of people think they have a little more better life expectancy and less risk for some events. But all this stuff is pretty safe. I think the unsafe one is, green teas has a lot of good health benefits. The most unsafe one is actually green tea extract. There's a very high correlation with liver failure with certain people, whether it doesn't agree with them. But green tea itself, chia seeds, most of these are fine. I would say that just be careful with any of the supplements like milk thistle or any of these that come like in an herb jar. They're totally unregulated. And my brother is a liver transplant specialist, and every month he gets someone coming in who took a supplement and had something in it, and they go into liver failure. So it's pretty real stuff that can happen. This is really common with like even other trends like alkaline water. There's a company that made alkaline water, then the same thing happened, so it went off the market. So you have to be very careful with what some of these trends are because you don't know what's really in it unless it's FDA regulated, which most of these aren't though. So, but most of them, like the natural stuff like green tea and chia seeds, are pretty safe, and I don't think there's really harm in taking it. Most things, if you haven't taken it before, just your body's not used to it. Try it a couple of times and see if it's out though.
You are a surgeon, we didn't ask a surgery question, but like, let's say if a orthopedic surgeon or doctor recommend like replacement of either hip or knee, and then, there is always that thing that buy something naturally or something. Are we just delaying the inevitable?
I mean, if you think about when you talk to someone about surgery, there's no like, I need to get surgery. When has arthritis, you could have horrible arthritis and have no pain or not be limited. The reason to get elective surgery is that other options have failed. So non-surgical care has failed. And that for arthritis is, anti-inflammatories, exercise, physical, there's some, steroid injections or other gel injections. But honestly, I don't think people get to the point for a reason. They get it from genetics, from obesity, from you're getting past your warranty for the joints. So suddenly changing your diet probably is not going to make a difference though, or suddenly, cutting something out may help a little bit, but the damage is done already at the point. It doesn't mean you have to rush to a knee replacement, but it means that action is probably not going to make a dramatic difference though. Yeah.
Thank you. Thank you very much.
Hi, I'm Priyanka. I grew up here in South Florida. Most of you know me. I went to University of Miami for undergrad and medical school, Chicago, where I did residency, and then Southern California for fellowship. I'm an ophthalmologist, and I specialize in cornea, so front of the eye. I'm in private practice in Southern California right now. I think just generally touching on general eye health, it's important to have at this age annual eye exams. Whether you're seeing an optometrist for glasses, that's perfectly fine. But a dilated eye exam, so they put drops in, they're able to look in the back of the eye, is really, really important, especially when you have other health conditions going on. So just being checked for glasses, at least at this age for this population, is probably not enough. We have the unique ability to see through the pupil, which is through the black part of the eye into the back of the eye. And we can see the nerves, we can see the blood vessels, and we can see manifestations of systemic diseases through the eye. So diabetes, high blood pressure, high cholesterol, if you have any of those conditions and they're not, being managed appropriately, they can affect your whole body, but we have the ability to see how they're affecting your body by looking at your eyes. So really important to have dilated eye exams routinely, which at this age would probably be annually, maybe or sooner than that if you have, something going on specifically. Another common condition patients come in with is dry eye. We're on screens, we're using our phones, we're watching TV, we're reading. Anything that requires focus, we don't blink as much, the eyes can get dry, and that can manifest as foreign body sensation. So it feels like you have an eyelash or sand in your eyes. It can manifest as burning, tearing, just generalized discomfort. So that can be treated with a lot of different, over-the-counter products like artificial tears, ocular lubricants. There's a lot of options for that. In terms of eye emergencies, redness, loss of vision, pain, flashes and floaters are big. So lightning bolts in the vision, black dots floating around, all reasons to go in and see your eye care provider. But I'm happy to answer questions if anyone has any specifically about the eyes. That's my baby.
I'll
Okay. So you have astigmatism. Astigmatism is, so basically the cornea, the front of the eye should be nice and round like a basketball. And some people have a misshapen, so it can look more like a football where there's two axes, not completely round. And that causes light to focus in two separate parts of the retina of the back of the eye. So depending on the degree of astigmatism, it can be corrected with glasses, contact lenses. Have they diagnosed you with anything specific like keratoconus?
Can phaco be used? That would be. Can they use phaco to correct the?
Astigmatism, if it's regular astigmatism, having cataract surgery, the lens can correct it, but that's only if it's regular astigmatism. If it's irregular astigmatism, meaning not perfectly symmetric, then no. Then no.
Just keep on changing your glasses.
So it's very normal for your prescription to change as you get older. Starting in your 40s to 50s, you start forming a cataract. That's the lens inside the eye starting to change shape. And that will then cause the prescription to change. If your astigmatism is changing every year, that's not normal. It could be a condition called keratoconus, pellucid marginal. It's all conditions that cause the cornea to become misshapen. So usually we don't see drastic fluctuations or increases in astigmatism unless there's another condition going on.
But does this eventually cause mind blindness?
No.
That is a different.
No, night blindness is a condition with the retina where the cells in the retina are damaged. That's usually a genetic condition. So no. Yeah.
So does it get fixed over the period of time or it's for like the patients there?
No. Yeah, so astigmatism usually does not resolve itself. So astigmatism is the cornea, the front of the eye is misshapen, but also the lens in the eye can contribute. So over time, it usually does not correct itself, but it can change over time as the lens in the eye starts to change. No.
Say the kid is 6 or 7 years old, he's growing up, does it get changed?
It can slightly change in children, but once you reach your adult age, usually by 13, 14, it wouldn't change drastically. No.
It can never fix. Maybe through laser treatment or anything.
Astigmatism, it depends on the degree. If it's a low amount of astigmatism, then yes, there are laser treatments like LASIK that can correct it. But it depends on the degree and also how regular the astigmatism is. If it's irregular, it usually cannot be treated. So astigmatism can be regular. So if you think of a football where it has two axes, those axes want to be symmetric. So like 90 and 180, 0 and 360. But some people have misshapen corneas that cause irregular astigmatism, where the steepening is only in one axis, so only at 180 or only at 0, and that's irregular and usually cannot be treated with laser procedures or lenses with cataract surgery.
So this lens is the only, sorry, so the lens is the only to let the shape clearly.
For astigmatism, so glasses can help, and then contact lenses. There are some procedures, they're called intacts, where they insert a prosthetic device into the cornea to correct it. It's not done commonly anymore, but if it's that much astigmatism or if it's irregular, contact lenses can help.
Right? Not understand. I mean, I had a similar suggestion. The doctor, he said, if not with the lenses, it will help you. You can let the kid see properly, but does it really help inside body with the lens?
So the lens won't change anything,
Right. That's what-
but the lens will give you clarity. Because right now, if you have that much astigmatism, glasses can only do so much. But a contact lens is sticking on your eyeball and can reshape the irregularity.
So the contact lens is better than the lenses.
Not necessarily better, but it depends on your degree of astigmatism and how much the glasses are helping you. Nothing is going to reverse it. Nothing is going to, make you better off in the future. It's just what gives you better clarity of vision right now. And for some patients that have a lot of irregularity or a lot of astigmatism, contact lenses are a better option because it gives them better vision.
But it will never get fixed by itself.
No,
But does it get worse?
yes.
Like, what would be the reason these people?
If you have a condition like this other gentleman mentioned, like keratoconus, pellucid, those are conditions that can change over time and cause the cornea to change over time.
What's the difference between an optometrist and ophthalmologist?
An ophthalmologist is a medical doctor, so we've gone to medical school. Depends on what state you live in, but usually only ophthalmologists can do medical procedures like laser procedures and surgery. An optometrist is also an eye care provider that can do similar eye exams, so glasses, contact lenses, eye screening, dilated eye exams. They can even treat some eye conditions like mild cases of glaucoma. They can screen you for cataracts, but once you have an actual medical problem in your eye, so your cataracts need to be removed, if your glaucoma needs to be treated further with laser or surgery, you would be then referred to an ophthalmologist. So screening exams are fine to get from an optometrist, but if you have an actual eye pathology, they'll probably refer you to an ophthalmologist to get further care. Good question.
What is the new way to do the cataract? Is it straightforward, laser, bifocal lens,
Yeah.
So what is the newest advance? I'm out of the touch.
Sure. Yeah, that's a good question. So cataract surgery is considered elective surgery, right? Nobody absolutely usually needs to have cataract surgery. But when you feel like your vision is not up to your standards, meaning you have lost clarity, even with glasses or contact lenses, you're seeing dim, dull, blurry. You have trouble driving at night. That's a big one for active adults. When you drive at night, oncoming headlights look like a starburst of light instead of a nice headlight. Or you look at the traffic signal and the red light has halos around it. Those are usually symptoms of cataract, also loss of contrast. So I tell patients if you golf, you have trouble seeing the golf ball against the blue sky, you kind of lose that contrast. So those are all indications that your cataracts might be visually significant, meaning you may benefit from surgery to get them removed. When we do cataract surgery, we remove your cataract, your cloudy lens, and we replace it with an artificial lens. The technology that we use right now is called phaco, meaning ultrasound. That allows us to remove the cataract in very, very small pieces through a very small incision, 2.4 millimeters. So usually after cataract surgery, there's no stitches, the wound self-seals, which is great for recovery. But phaco is the standard of care right now for removing your routine cataracts. So laser is different. So laser, you have the option to, if your ophthalmologist offers this, you have the option to add laser on to your cataract surgery. The laser is done before the surgeon removes the cataract. At the same time in the operating room, it's not, two separate visits. And the laser does certain steps and can add on to your cataract surgery. So the laser can make the incisions, can make the wounds through which we go through to remove the cataract. The laser can pre-treat and soften up the cataract so that when we go to remove it, we're technically putting less energy into the eye. The laser can also treat small, regular amounts of astigmatism. So the laser is not covered by insurance. It's an added cost on to cataract surgery. And the laser is completely individual. If you can afford it, if you feel like there's benefit, yes. I tell my patients that it's a nice option. It's a nice technology that we have. It adds precision. And it treats small amounts of astigmatism, so it can give you even better vision afterwards. In terms of lens options, similar to your glasses, the lens that we put in at the time of cataract surgery has a power to it, and that decides where light is focused. There's a single focus lens, it's called a monofocal lens that has one focal point. That's the standard lens that insurance covers. Usually young, active, independent adults choose a lens that has a distance focus. So you wake up, you can see the clock, you drive, watch TV, you're set, but anything up close will be blurry and will require reading glasses, which most people don't mind. The alternative, it's the same monofocal lens that insurance covers, can give you a near focus. So artists, writers, people whose whole world is in front of them can prefer that lens so that when they're working, everything is in focus. But as soon as they look up, most things are blurry, and they have to wear glasses for that distance. We have the option to upgrade those lenses. There are lenses that can give you kind of a range of vision, kind of like how you have bifocal, trifocal, progressive glasses. There are lenses we can put in the eye that make you less dependent on your glasses. We never say no glasses. We never guarantee, we can't predict the future, but there are lenses that can be put in that can give you good near, distance, and intermediate vision to make you less dependent on your glasses. Again, those lenses, like the laser, are not covered by insurance. There's an out-of-pocket cost to them. But the goal is that it may give you a little bit more independence, especially as you're getting older, and make you less reliable on having to find your glasses. So that is an option.
Are you using laser in your surgery?
I am.
Well, if somebody can afford it, what would be your advice? Check on or check with laser book.
I think if you have regular small amounts of astigmatism, I think it's a good option to treat that. I think there are some patients that have certain eye conditions that would benefit from the laser. I'm a proponent of it. I think it's a good technology. If you can afford it, I think it's a good option.
If you cannot budget for generally, how much it would cost?
It depends. It depends. Average, probably 1,500 to 2,000. Yeah, average. I mean, I'm in California. I don't know what it is in Florida.
Whenever we go for the eye test, or, the eye visit, they ask us to sign some particular test, which is they always claim that it's not covered by insurance. What is that test?
I think that's when you're seeing an optometrist. And I think optometrists might do additional screening, like a visual field, or they have a special machine that can take a picture of your whole retina. And unless they can tie that to a diagnosis, they can't bill your insurance for it. So it depends on your insurance, if you have a straight vision insurance or you have a medical insurance, but usually through your medical insurance, if you have a diagnosis, which usually in your late 50s, early 60s could be a cataract, right? It could be that you're a diabetic and we're screening to see if the diabetes has affected your retina. Same with hypertension. Those are all medical diagnoses that they can use to bill your insurance. But if they're just screening tools and if nothing kind of pops up on them, I'm guessing that's what they are having you sign.
Thanks for coming.
Yeah, of course.
To prevent the getting cataract or retina issue or we don't know.
Yeah.
People have once in a year, and it's all right.
Yeah. Yeah, so I think it depends first, I think it depends on your systemic health. I think if you're a diabetic, if you have high blood pressure, if you have high cholesterol, getting those under control is number one, right? So diet, exercise, seeing your primary care physician, being compliant with your medications and treatments is number one. Because if those conditions are not controlled, there's only so much that we can do, you know, for the eyes themselves. There are treatments if those conditions do affect your eyes. There are treatments that we can offer, but the base and the root is control your systemic medical conditions. In terms of cataracts, it's an age-related change, just like getting wrinkles and gray hair. It's helpful. It's helpful to wear sunglasses when you're outside. That UV protection helps. Don't smoke. Don't be around people who smoke. If you're on steroids or chronic steroids, that can cause your cataracts to advance a little bit further. And then diabetics also can have cataracts that manifest sooner. The nice thing about cataracts is that we can treat them. You know, if you have cataracts caused by, you know, being on steroids or being a poorly controlled diabetic, that can be treated. It's just there are conditions with the retina, with the back of the eye, like if the diabetes were to affect the retina, it can cause permanent damage if it's not addressed soon enough. So I think the best thing is getting your routine eye exams. Yeah, at least at this age, I would say every year, especially if you have cataracts or you have diabetes. Usually for a well-controlled diabetic, it is yearly eye exams. If you're a poorly controlled diabetic, it would be every 4 to 6 months, just depending.
Hello, Priyanka.
You should, yeah, because your vision is what you know. If things, yeah, go ahead.
You mentioned that the lens is some doctors are recommending monovision,
So that's called monovision. So there's one eye that they aim distance and one eye that they aim up close. And the goal of monovision is that it gets you out of glasses because you have that range, you have the distance and the near vision. There are some people that naturally have monovision. That's just how they're born and that's how their eyes are. And I think if you have that, that's great to keep. There's some people that do monovision in contact lenses. So, you know, when they're younger, they have a contact lens, one for near, one for far, and they do well with it. I think my personal opinion is that if you've tried it and you like it, great, do it. I would not get it put in your eyes with lenses from cataract surgery if you've never tried it before. The reason why is that when there's such a discrepancy in the prescription between two eyes, you lose depth perception. So pouring water into a glass, it's hard to kind of gauge where that glass is. Parking between two lines, steps when you're walking downstairs, it's kind of hard to gauge depth. So a lot of people, also playing sports like tennis, seeing where the ball is when it's coming at you. So a lot of people who have never tried this before, it's hard for their brain to then accommodate to this drastic difference between the two eyes. And some people do well, some people don't. Once we put those lenses in for cataract surgery, we don't like to remove them. It's a more complex surgery. So we like to get it right the first time. So if I have a patient that already does monovision in their contacts or was born that way, I recommend it 100%. If someone wants it, I have them try it with contact lenses. Try it for a month, see how you do, see if you're comfortable and happy, and then fine, do it with cataract surgery.
And if that should like I give it like that goes for 20 years, 30 years.
The lenses for cataract surgery, they should be good. Those lenses rarely need to be removed or exchanged. Sometimes if there's a trauma, like you get into a car accident, you fall and hit your head, that lens can shift, move, change positions, then that can require another surgery. But if the eye is healthy, the lens has good support, usually once it's put in, it stays there.
So I agree with that. They say that I need it, very exclusive, but I have used it. I can stand by. Should I do it or should I not?
So that's a tricky question. Very, very rarely will we tell a patient that you need cataract surgery. The reason why is usually cataracts are not dangerous. They're not going to damage your eye. They just affect the vision. There are rare cases where the cataract gets so big, it takes up too much space in the eye, it can cause the eye pressure to go up. Lens particles can leak through that giant cataract. Rarely, if the cataract is so bad, we can't even see past it. Just like you can't see out of the eye, we can't see into the eye. But if you are comfortable, if you can, do all of your daily activities, your activities of daily living, if you are comfortable, then no. But again, cataracts are extremely slowly progressive, right? They happen over years. Nothing usually happens overnight. So usually we may have patients that have had cataracts for 10 years and say, no, I'm fine. But you're failing vision tests when you go to the DMV to renew your license because you don't know because this is so chronic. So as long as you're legal to drive, if you're driving, as long as you are comfortable doing everything that you want to do, then no, there's no urgency.
Can I ask a question?
For this laser effect, like for fingerprinting.
The prescription has to be stable for, I would say, at least a year. So usually kids are growing. Their prescriptions are not stable until they at least reach at least 18, maybe even 21 years old. So it's not recommended to do it in kids.
So, can you tell me about low pressure glaucoma and the high pressure glaucoma?
Yeah, so glaucoma is a disease where the nerve that connects your eye to your brain gets damaged. And that damage can cause you to lose vision. Initially, when you have glaucoma and you lose vision, it's the peripheral. We don't really use our peripheral vision. We turn our heads to look, right? So a lot of people that have glaucoma don't know they have it until it gets to very severe stages when you can eventually take your central vision. The vision that you lose from glaucoma is irreversible. It doesn't come back. There's no way to bring it back. So that's why if you have glaucoma, it's important to, see your ophthalmologist, use your drops, be treated for it because it can cause blindness. There are a lot of types of glaucoma. Glaucoma can be genetic. It can happen after trauma. It can happen after inflammation or an infection. There's a lot of different ways it can manifest. Usually when we think of glaucoma, we think that the pressure in the eye is high, and that high pressure is damaging the nerve, and that's causing the damage. There are other types of glaucoma like that happen from inflammation or trauma. And there's also low tension glaucoma that even though the pressure is in our normal range, it's still too high for what the nerve can take. And that those, when we look at the eye, when we look at the nerve, can present in different ways. They usually have similar treatments. Usually there's a stepwise approach to treat them. There's eye drops. There's, multiple different types of eye drops that can be used to lower the eye pressure. There's laser procedures that can be done to open up the drainage channel in the eye that can help fluid flow out. And usually advanced stages may need surgery. So a drain or a tube placed in the eye to help relieve that pressure.
I think there's low pressure.
So that's when the pressure is in our normal range, but it's still damaging the nerve. That damage is causing the peripheral vision loss. Yes.
So only the cure is to do with the eye drop.
Either eye drops, laser, or surgery. Yeah, those are the usual, those are the only options we have to treat it.
What can cause varying vision, rapidly changing vision?
Rapidly changing vision,
Yes.
a lot of different things. It can be an infection, it can be inflammation, it can be a change in your prescription, cataracts, a lot of different swelling to the back of the eye from, a systemic condition, a lot of different things.
Can dry
Dry can cause fluctuating vision. So usually we say, you wake up in the morning, you're fine, then you start reading, you start your day, you're using your phone, and the vision fluctuates. Sometimes it's clear, sometimes it's blurry. So yes, dry eye can cause fluctuating vision, but usually not, unless it's very severe, usually not permanent loss of vision.
Thank you.
Yeah.
Yeah, so I have a question. This is Mohit. So couple
I'm sorry,
things.
say that again?
Yeah, if I used to do it, I exercise every day.
Oh, yeah, good question.
You can make it 2020.
Yeah, so none of that's proven to be true, unless you have specific conditions like strabismus, where the eyes are not aligned. And they might advise like pencil push-ups or exercises, you look near and far. But otherwise, just generally looking around, exercising those muscles. It's not like exercising other muscles in your body. Those muscles don't necessarily contribute or cannot get stronger, and it doesn't really help. It won't hurt. It won't hurt, but no, it doesn't.
Hi.
So why is time to have connection? People say before it fully develops, I mean, I would go after my recovery, practically 5 years. They all keep saying we are developing, but it's not there.
Yeah, it's only when the symptoms manifest. So when you no longer. And you'll know, vision is not clear even with glasses on, trouble driving at night, loss of clarity, loss of contrast. When you start to feel like you're just not comfortable with your vision,
So
it's considered an elective surgery. All surgery has risks, right? Bleeding, infection, need for more surgery, swelling to the front of the eye, swelling to the back of the eye. Every surgery has risks. So with cataract surgery specifically, we weigh that risk benefit. Are the risks of surgery worth the benefit? If you're not symptomatic from the cataract, if you're perfectly comfortable, you're seeing well, you're passing your driver's license test, then it's not worth taking those risks.
yeah, hi. I have a question I am online.
Yes.
Question is, like somebody who has been generating very high mileage,
Okay.
and if that person develops high peak atrophy or degeneration, can anything be done?
So usually once that atrophy, that degeneration sets in, usually nothing can be done to reverse it, but there are other conditions that can manifest from that degeneration. So if the retina becomes too thin, there can be breaks in the retina, there can be new blood vessels that want to grow in, there can be swelling. So there's treatments for those manifestations that can happen after the fact, but there's no way to reverse the damage from that congenital or that high myopia from birth. Yeah, unfortunately. Yeah.
Is there any, this is my nephew, my brother's son, was 18 years accident to the courthouse. It's about optic nerve surgery. And we have to rely on it. Somewhere in Israel, they say they have developed some kind of technology to what you call it.
Use the cabinet.
Yeah. Are you aware of anything? Is both optic nerve is
They're favored in the foot of the
Yeah,
So
unfortunately, right now, there's no way to regenerate the optic nerve.
No, it doesn't read it, but anything loose symptoms that from retinal signal goes to.
Not that I know of, not right now. I'm sure people are working on something, but right now, yeah.
Something can be done. Are you practicing in Florida?
No, I'm in Southern California. Yeah, you can come to California.
Yeah.
Feel free.
Can you hear me, Priyanka?
As a, South Indian, South Asian, populace, are we predisposed to any particular eye condition that we should look out for, which is not in the regular kind of a recommendation from the eye,
Yeah.
ministry?
Thankfully, no. Thankfully, there's nothing specific to South Asians. But we are prone to diabetes. We are prone to high blood pressure. We are prone to high cholesterol. And all that can manifest in the eyes if it's not controlled. So those, yes, are very prevalent. But otherwise, nothing specifically genetic or anything like that.
My brother has art pain.
Yes.
So is there any research, any cure for any glasses? I heard that there's special glasses that something helps in Listen.
Yeah, so any patient that has, we call it low vision, basically vision that's just not up to what you want it to be. There are low vision specialists, usually they're optometrists, that can give you tools and ways to make the most of your vision. So RP, he has very limited vision, very limited field of vision. So there are specific like monitors, projectors, magnifiers, devices that give more light that, you know, you can put a book under a projector and then it'll project onto a screen with very high contrast. So there are ways to make use of the vision that is left, but unfortunately not bring back the vision to what it was maybe 50 years ago. Not yet, not yet.
Let me know.
Yeah.
Any question from the Zoom?
Yeah, hi. Priyanka, can you hear me?
Yeah, I can hear you.
So I have a couple of questions. I know a lot of parents are there, but the kids are in Pathshala in the
Okay.
back. But I'm hoping that parents are able to make the kids hear this recording. So the first question is, there's a lot of screen time going on with the kids and the gaming. So if you can elaborate on the health effects, the eye health effects and the brain health effects for a lot of screen time for the kids.
Sure.
That's my one question. And then the second question is, the parents themselves are spending a lot of time in front of the screen, being in the IT and stuff like that.
Sure.
So are there any exercises or good practice to keep the eye healthy? If you don't mind repeating these questions, because I don't think the other people are able to.
Question was how to deal with kids who are constantly on screens using video games. There are studies that have shown that, you know, in kids, the more they focus up close, whether that's with schoolwork, whether that's with gaming, whether that's with computer use, the more they're accommodating to allow them to focus up close, and the more they are likely to get myopia, so nearsightedness. So of course, work is fine. Limiting screen time is the best thing, but the studies have shown that at least in children, in babies, it's allowing them to see distance. So at least 2 hours a day of distance viewing. Usually that's outdoors time, being on a playground. That relaxes the accommodation, that relaxes the drive for their eye to want to become nearsighted. And that's definitely something that can help. The other part of the question was in adults. A lot of adults that are working in tech or that are on the computer all day, are there any specific eye exercises that they can do? Not really eye exercises. The recommendation is to take breaks every so often. The recommendation is that every 20 minutes, get up for 20 seconds, look 20 feet away in the distance, and that also can help with eye fatigue, with dry eye. It's hard if you're working to make that feasible, but every half hour, every hour, if you're able to just, you know, take a break, look in the distance, blink. If you do have eye fatigue, if you do have dry eye, artificial tears can help. But the use of screen time, at least in adults, won't cause those same effects as it will in kids, and is not necessarily harmful, but it can cause eye fatigue, it can cause dry eye.
On the question, I have like, is that those blue light blocking or yellow light blocking glasses help?
So blue light glasses can help circadian rhythm, which is basically your body's time clock to say, okay, now it's time to go to sleep, now it's time to wake up. But in terms of fatigue, eye health, no. The best thing is UV protection. So when you're outside in the sun, just sunglasses are good to keep the eye healthy.
Thank you. Okay.
Very nice presentation. Both of Priyanka. Okay. Now, today we have special guest here with us. Otherwise, first we so I must emphasize we are going to Bengal and showcase the Bengal convention next year in Chicago. So that's like
Sorry, I will not a doctor.
all them follow with him.
But actually,
a lot of good knowledge now, for us to write. We are also glad we getting those a little bit, so.
Past behavior was enough to convince the cross.
Thank you.
That he should be rearrested.
Actually, we are here reading, the reading was, there was a reading what last days and we attended that. I like to actually first introduce because they want to leave that, our Parliament president. I can tell you one day is handle 180 players. Yeah, we have lots of activity always happening in the Parliament. So, and they are always, is very calm and, handling all the 180 ladies and.
Handling a women, not easy.
We started last time. We started last time.
Please.
Please,
Yes, you're sure.
we have a committee, which are president, vice treasurer, secretary, joint secretary, like, the so thank you, Mr. Ben. We had other folks from the, also came in, like, one of joint secretary, my nephew just left, who was the joint secretary. And also we had the board of trustee, they left this morning. And when we had one, bench in Parugani, she has a 12, what's it going on with? So she was here also, so that's a good Chicago Jew over here.
સમય કરીએ જાપ કરીએ પૂજા કરીએ પછી આવી રીતના બધા સ્ટેજ અમે એક વાર પીડ્યો અમે અહીંયા પણ આવી રહ્યા છે
ના આ દેરાસર આવેલા શિકાગો ક્રુઝ માંથી આવેલા બધા
ના ત્યારે અમે નહીં અમે ઓનલી મહિલા મંડળ
ઓ અચ્છા મહિલા ઓકે સિનિયર ગ્રુપ હતું હા ઓકે ઓકે
મેડમ ઇન્વિટેશન આપી દો ઇન્વિટેશન આપી દો
આપી
Other than consider this as an invitation. Whenever you want to come, definitely welcome.
અમને લાભ આપજો.
By the way, we have senior group. They also have a big nearby leaders, secretary.
કેટલા બીજા ગ્રુપ છે
But at the same time, we can handle this all teamwork group, this group, that. So what we have done that we have created a committee of the Digambar group. We have created a committee of Sivan group, Anakwati group. They work under the Change Society, main committee. And so that way, like, we have lots of Digambar folks, right? We don't want them to come every question, concern, whatever that they in the committee. So what we have did that we have created the government for data group for the standard perspective. They collect the and they get everything from one person. Their representation come to the personal question to the team society. So we have like almost 30 committees. We also have food board. We give the, lots of things going on there, in Chicago. But that's by the way, always handling clinic. He's a doctor, and he handles the clinic, parcel, he handles clinic. So, he's the parcel for that. Okay, all right. Let me give you my introduction to start with that. I started in 2002 in James Society, and I was the first young person who joined the committee at that time. And actually, what happened that we had $12 billion, expense was happening, and we took a that from the bank, and that's where I started. We had not that many program before, but now we have 160 throughout the year. That's not including religious, but also we have healthcare, we have like cricket league happening, all so many things we have doing that. So because that helps like in creating a bonding and teamwork among us. So we have lots of hosts and then lot of different activities happening. Playing bowling and all and also religious things, right? By the way, so like during the then I was the president in 2008 to 2011. And then the president in 2009 was really bad in the situation in the society in the USA. And we paid up the temple that $12 million at that time. And then after I was just board trustee, and I was the chairman for 2 years to 2019. And also I got the opportunity that I, a lot of folks knows that Supai Dumaria, he China in 2015, I was the food chairman in 2015 in China. I was a youth chairman in 2017 in China. And then also last minute I also handled football issues and whatever. And they made me a food chairman at last minute in 2017. Then 2019, I was the treasurer, and 2021 was, the virtual, and 2023, very happy to work with in this by. Really, I'm really proud, of working with this by. Very unbiased person, but very bold. At the same time, very good teamwork among everyone, so really thanks to, working with, with this guy, he's a president, vice president. Fortunately, I got the opportunity to take care of the, convention in Chicago. So I want to start with the Chicago Convention of 2025, which is July 3 to July 6. And so these are the logos have been, selected in past convention. We just, decided our theme, which is unity to peace. We just did in 2 days back. We have about almost 33 people on the board, including Musalia. So he is one of our convention board, a member. And you can see that convention schedule a little bit different what we are doing in this. We will be starting the first day instead of 5, 6 o'clock. We will be starting around 2, 3 o'clock. And then instead of having Garba first day, we will be used of that night and we maybe do something different so that we can do more activities in the convention. These are all the convention board members. This is the biggest convention board in a history. 30 members in total all together in convention board. We have a co-convener. So Vipul Shah, he's the current chairman of the Society of Chicago, and he is also the secretary of China. He's co-convener. And Jignesh Shah, he is a board of trustees in Chicago, and he's also co-convener. We have steering committee, which is the experienced, members there. So it's myself, Vipul, Jignesh Bhai, Harish Bhai, who is past president. Mahesh Bhai Wadari, he was also past president. Deepak was, we were working in China before. And Piyush Gandhi, he also always helping a lot in the China community. By the way, Dr. Mansukh Bhatia, he is one of our senior housing committee members, so he's very good help on our senior housing. We are working on to do the lot of houses in here for people wants to really move to Chicago, Florida, to spend their senior time. And communication facility, basically we have a capability of almost 1,600 people capability, but after having this we will have capability of 5,500 people. Yeah. So you can see that here we have this convention center on the left all the time. That's like 2,100 each to the all capability, and then we have lots of room. On the right side we have big hall real leaders are, over, dining area. Sorry, we go to second floor. Yeah. Okay, so on the second floor, we have almost like 150 rooms, and we can also, remove the partition and then can go up to 600. So there's one side, and the other side is about 450 people accommodation. And there's lots of others, ladies and something like that. So this time what we did is that we have, reserved two places. So one, the convention center, that's for the completely for the adult, programs. And then we have a higher, there is a ballroom capacity, there is lots of other room there. Then all the youth program will be happening there. So YJ, YJB, J Connect, and also job, all the programs happening in the higher. Which is about 3/4 to 1 mile far away from the convention. One more thing that in convention center, we have a capability of, 500 rooms. Those rooms will be actually, first come first, where as soon as you do the registration, make sure if you want a, the room, that just make the reservation right away. Because, only 500 rooms, out of 500, only will be, 400 will be available. There will be reserved for the, dignitaries and the donors, the big donors. Our team, basically, Chicago really is known for unity. Our team, Chicago, works so great. And the Chicago, Digam, or every, Tanakosi, even everyone works so together. And like we know, like this, the senior thing, right? So senior, everyone, right, work together. The big unity committee. And there is always, in committee, when the meetings, always, some concern question happens between the committee members, but when we present to the members, the great unity. People are very, very happy and completely young committees handling all this technology wise and all these, 30 different committee also they have to handle it. So our team is unity. Next. If you can you. So I would like to actually have આપણે ગુજરાતી બધા સમજતા છે કે I don't know if somebody don't speak in Gujarati, let me know. But તમે લોકોએ જે સાથ અને સહકાર વિદેશભાઈને 2023 ના કન્વેન્શનમાં આપ્યો, એવો પણ તમારો પણ સહકાર અને સાથ તમને પણ મળે, એવું હું તમને પ્રાર્થના કરું છું. Thank you very much. Any question?
How many chains, Chicago, how many chains?
Almost 9,000. I don't think we can accommodate everything. We can
New Jersey proper. But still, it's too density is too high. New Jersey.
We are every part of almost 15 to 2,000 people now. Actually, this facility of really 1,000 square feet is not able to handle now. anything, and we drive for the morning.
So register early and book it.
Stay in a hotel. But the thing is about there's a lot of hotel nearby. In 2 mile area, there's lots of hotel, so having the rooms capability and then higher than 250 capability. They have 500 capability, but then they have contract with the American airline for 250 euros, so we did not give us, but there's a lot of, hotel nearby. Public transport, then we,
No, we will have bus service.
so there is a as a public transportation between these two hotels. Continue every 50 minutes. But on top of that, we will be also bring the room, bus. Yeah. Are we thinking to sometime in July or August, we are thinking about it, that's opening there.
Traditionally, it's August time frame.
Yes. Yeah. Yes.
How many are expecting? 5,000, 6,000 people?
Well, I am thinking, I'm thinking we can handle max 7,000, which is 5,500 adults and 1,500 youth. We can handle that many, that's it. But I'm telling you, this time, even first time, the Kerala Jain Association president came to my house 4 5 days back, and he said, "No, we never involved, but now we want to involve." I said, "Do you guys understand Hindi?" No, we understand Hindi. We don't speak, but we understand Hindi. But they 180 families throughout the USA, and they say, "Okay, we will at least 134 people." So first time they'll be involving also. So I think some Jain, association. Right? So there's lots of work. I went in India, I did a 33 days of a trip in India. Lots of we went to the blessing. I met Narendra PM or Priyanka. I also met Adani's wife, Priti Adani.